Right, good morning everybody. What a fantastic audience, you just all went quiet at the right time, that's brilliant. And as we know, health coaching is about participation, so that's a fantastic start. So I'm Liz Mear, I'm Chief Executive of the Innovation Agency and Chair of the Academic Health Science Network, and we're really pleased to be supporting and sponsoring this day. So we're here today to talk about conversations. We're here to talk about health coaching and how we need conversations with patients, service users, carers, and with clinicians across our system. So we're all here because we're interested in that. So I'm sure we've all got really fantastic experiences of where it's working already. But we want to scale that up and we want to start a movement that's about health coaching and working and having better communications with the people that we serve. So this morning's we've got some fantastic speakers, hi Michael, one coming in now, about the conversations that we need to have across communities and systems. And this afternoon is how we pull all that together. So how in our particular systems do we start to pull that together and start this moving across the system? And health coaching is actually based on evidence. When you start rolling out health coaching, people's quality of life improves, they start to be able to self-manage their own conditions, take responsibility. Economic analysis shows that costs reduce as people don't have to come back into hospital. They feel more empowered to take decisions that are right for them, so they don't need our services as much and they're able to live a fuller life. Now, some of you might have seen the press release that went out before today, and there was a fantastic example of a mum talking about her son and how health coaching has transformed the conversation between them and his life. And the mum's called Mandy, and her son had cystic fibrosis. And she talked about that nagging him, getting him to do things by constantly reminding him, telling him he ought to do things or he would be in trouble with his health wasn't working. And her comment was that she knew this approach wouldn't work for her son. And really sadly, she said, I don't want to be going to my son's funeral. I need to be doing something different to support him. She came across health coaching and she realised that this approach was for her son. And she started looking into cystic fibrosis and how many people adhere to the meds. And it was about 40%. So she thought this was a good way to start to talk to him about how he thought he would be able to adhere to his medications. And he decided that actually he wanted to avoid having intravenous antibiotics. That was his motivation. And by thinking about that and thinking that if I use my nebulizer, I'll be able to reduce reliance on IV, he got his meds adherence up to 80%. So he found his own internal motivation for managing his meds. He also had a problem that people with cystic fibrosis tend to put on weight. And this actually was very disempowering, made him feel unconfident, and he decided that he wanted some smart scales. So they got him some smart scales. This was his solution, and he managed to keep on top of a problem that could have got out of hand. So she felt that actually, in conjunction with herself as a carer, in conjunction with health professionals who were willing to try a health coaching approach, her son's life had been changed and she wouldn't be going to his funeral. She would be supporting him to have as healthy life as possible. And I think we'll all have stories like that, and we'll be listening to stories today and being able to work out how we make these approaches work in our communities, our STPs and across our systems. So this is our programme for the day. You've got it in your packs. And we're going to move on to a session about changing the conversation. So how do we move our conversations from being hierarchical, parent-to-child conversations, to being equal conversations with residents, service users and patients, so that everyone benefits? And our first speaker, lots of you will know her, is Dr. Penny Newman. And Penny is the Medical Director for Norfolk Community Health and Care NHS Trust. And she's an NHS Innovation Fellow. And all the HSNs support the NHS Innovation Fellows, and they are innovative programmes like this or products that help us to improve quality in healthcare and reduce cost across our systems. So I'm going to invite Penny to the stage, and Penny really is not the expert in health coaching, but one of the experts in health coaching, and she's always keen to point out that this is a team effort. She's worked with some fantastic people who we'll be hearing from today, and she's representing them. And Penny's going to come up to the stage to talk to us now and give us more of an overview of the day and what we're going to hear.